Hi, I'm Dr. Joe Kaushik, andrologist practicing at Caroline John Hospital, Nagarkoil. So today we'll talk about the one of the most common treatment which is employed all over India and even worldwide, which is the P-shot injection. So why is the P-shot injection used? So first of all, we should know in what conditions of erectile dysfunction this P-shot injection is used. So basically, when a patient comes to us with erectile dysfunction, or if a person is having erectile dysfunction, which means the blood flow inside his penis is not proper. It can be either the inflow of blood into the penis is not proper, or else the draining of blood from the penis through the veins is happening very fast so that he is not able to maintain his erection. So, for that to understand, we should know what are the mechanisms which are involved inside the penis for the blood to pool inside the penis. So, first of all, the main component which is involved in bringing the blood inside the penis is the penile artery. So, the penile artery has two things. One, the vessel wall, and the second thing is the innermost lining of the vessel, which we call as the endothelium. So, what is the endothelium of the penile artery does? The endothelium helps in the conversion of helps in the breakdown of ATP to AMP, which in turn increases the nitric oxide secretion, which we call as eNOS, which means endothelial nitric oxides. So this helps to pool the blood inside the penis so that the erection will be harder and stronger and lasting longer. So this P-shot injection will be helpful if there is any damage to the innermost lining of the penile artery, which is the endothelium. So if a patient has a problem with the penile arterial endothelium, then the P-shot injection will be helpful, and there are different variants of P-shot. One which we call as the regular P-shot, which we take the blood from the patient and we inject it directly into the penis. So for this process, we take around 20 ml of blood and we add certain medias and we segregate the platelet-rich growth factor or the PRP, platelet-rich plasma, and we inject it inside this penis. So this is the most common variant of the P-shot which is followed everywhere. But nowadays there is a more advanced form. We call it as PRGF, which is around 20 times more potent than the regular P-shot. So this kind of injection will have a more concentrated amount of growth factors, so which helps in the healing of a better endothelium. So if a P-shot is required for around 4 to 6 times in a period of around 6 months, which means you will require to get a P-shot once in every month. But if you are going for this more potent form, then you will require a single injection, which will be giving you a result for around 2 to 3 years. So all this P-shot or PRGF injection will be helpful if you have endothelial dysfunction of your penile artery. So if you have some other conditions and if you are going for this P-shot or the PRGF injection, then it will not be effective for you. So first of all, we should know exactly what is the cause for your erectile dysfunction, and then we should go and treat it. So that is the take-home message for you. So P-shot will not be effective for every patient or everyone with erectile dysfunction. P-shot or PRGF will be effective for the patients with or the persons with endothelial dysfunction of the penile artery. It will be effective and it will give a very good result. Thank you.